Hi, everybody. Good morning. I'm Dr. Harris Huberman. I'm the director of the Division of Child Development in the SUNY Downstate Department of Pediatrics. And as a developmental pediatrician, autism is both a central part of the work I do professionally, but it's also personal. I have a daughter, now adult, with autism, and when she was about 3, she wasn't talking. She was very much in her own world. Now, she's related. In fact, there's times when she doesn't stop talking. She's an artist. She writes, she illustrates children's books. She's doing great. Just to give you an idea of the range of possibilities. So today I'd like to talk about autism and what we're trying to do about autism here at Downstate. But first I'd like to discuss what is autism, and because it's not simple and a lot of people have misconceptions or don't get the full picture of autism. I'd like to talk about autism over the lifespan and what the life course can be, what the future holds. Thirdly, I'd like to talk about treatments and programs and services to support children and individuals with autism, both in the medical field, as things we're doing here at Downstate, as well as schools and social services. And that brings us to the question that those services are often not fully available to all of them who need them, and it gets into an issue of health disparities, which I'd also like to talk about. And finally, I do want to talk about what we're doing to address these disparities here at Downstate. First of all, just how common is autism? The current estimate is that about 1 in 36 children will have autism. So in Brooklyn, that comes to an estimate of about 18,000. It's a big issue. So let me start. What is autism? I'd like to sketch the range of what autism can look like. We see teenagers and children in our developmental clinic on the one hand who don't speak, who have meltdowns if there's the slightest change in their routine, who flap their hands, who hit themselves, and seem completely oblivious to people around them. On the other hand, we also see children and teenagers who are doing fine. They're in terms of academics, they're in general education classes, but socially they have difficulties. They can be awkward, they may not pick up on other people's social cues, they may have few or no friends, and they're becoming socially isolated. And then there's all the kids in between. And on top of that, there's a lot of kids who have other types of conditions that, like ADHD, language delay, intellectual disability, anxiety, that can overlap with autism. So what is it that makes it autism? And I would say there's two things. One is having a problem with social communication. In other words, being able to have a back and forth interaction, using body language to express ourselves. I think we all tend to do it without thinking, giving eye contact, and making and having friends. And these problems can range from someone who's completely oblivious to others to much more subtle difficulties. The other component of autism is rigidity, either saying things or moving in a repetitive way, always exactly the same way, or insisting on following the exact same routine, or being obsessed with one subject. Everything is about Pokemon or something like that, and as well as having sensory issues. So based on what based on what parents tell us in terms of a child's developmental history, as well as what we see when we interact with the child directly, we can make a diagnosis of autism spectrum disorder. Please, have a seat. So let me talk about autism over the lifespan. In our clinic, we're often diagnosing 3- and 4-year-olds with autism, and we're trying to explain it to their families. And one of the first questions we get from parents is, well, what lies ahead for my child? Will they ever talk and communicate with me? In school, will they ever be able to attend a regular class? Are they going to go to college? Are they going to get married? And I respond, and I'm honest, and I say, every child is different, and I don't know what will happen with your child. But overall, at a population level, we can say some children do continue to be severely affected and have a lot of needs. Some improve so much that by their late teens, there's no autism apparent at all. Mostly people fall in between. Okay? So this brings us to the issue of neurodiversity. The recognition that as human beings, we all have different ways our brains work and that we act and behave in the world, and that this is part of the range of human experience. And for some with autism who are very verbal, who are on their way to college, there's a lot of pushback to the idea that autism is a disorder at all. I'm thinking of one of my patients who, when asked about the idea of should we be looking for a cure for autism, he said, the idea of a cure is absurd. He said, if I had the choice of not being on the spectrum, I would say no. I'd still be on the spectrum because it made me who I am. So, is autism a disorder? For some, it's not. It can come with blessings, and I think we have to respect that. For others who are minimally verbal and self-injurious, it clearly is a disorder, and we should try to help them and find treatments. So this brings me to what are the treatments and the programs and services for autism? Well, first of all, let me say there are no medical treatments for autism itself, although we're involved in research here at Downstate to hopefully develop some. But as a child development doctor, I'm often prescribing medications to help manage different symptoms that go with autism, like inattentiveness or hyperactivity or anxiety or agitation. But I'm clear that we're treating a specific symptom. We're not treating autism itself. Other medical specialists also are important, like neurologists who both diagnose autism and address problems like seizures that are common. Feeding problems, stomach and GI problems, gastrointestinal problems like reflux and constipation are also very common in kids with autism. And having our gastrointestinal specialists help is crucial. And then child and adolescent, and as well as adult psychiatry, to address the mental health problems that people with autism often experience as they get older. Really, really important. But for all that, the main treatments for autism aren't medical. They're behavioral approaches and therapies like occupational therapy and physical therapy and specialized school programs. One of the most recognized and proven behavioral therapies is called applied behavioral analysis, or ABA. And when properly done, especially when it's begun early, can really make a difference in terms of improving social communication and long-term outcomes. Occupational therapy has a particularly important role in autism treatment, including addressing sensory issues and supporting social engagement. So this brings us to the question of health disparities, and that these services, which can make a difference, are often not available to poor families, including those here in Brooklyn. Firstly, children with autism from poor families and families of color typically are identified at much later ages, meaning there's a delay in starting services. And to get one of the main services, ABA, children less than 3 and diagnosed can get ABA through the earlier intervention, whether they're poor or not. But after age 3, ABA is only available through health insurance. And until this year, ABA was simply not available for folks with Medicaid. That's changing now, but it still remains very difficult for poor families with Medicaid coverage to secure ABA services for their children. Another major disparity that applies to even broader sectors of our community is that of accessing mental health services. Families who can afford to pay out of pocket, which is not most of us, can get private psychiatry services. But for families depending on health insurance, finding child psychiatry services is very difficult, and especially so for children with an autism diagnosis. And to get child psychiatrists and community mental health programs willing to see them is a real challenge. So finally, I'd like to talk about what we're doing here at Downstate to address these issues. First of all, pediatric primary care and family medicine primary care is key in terms of early identification of autism. And Downstate's pediatric outpatient clinics do systematic screening for autism and developmental problems as part of regular care. And in fact, right now, we have screening going on in the peds area, which includes both autism and developmental screening. I help run a child development clinic that does autism diagnostic evaluations, as well as provides ongoing care. The child neurology clinics also do autism evaluations and provide neurological care. We have other specialties, including gastroenterology, that address autism-related GI problems. I'd like to mention the School of Health Professions that includes the occupational therapy, and can I give a plug for the OT booth and sensory gym going on outside, as well as PT programs. And very importantly, they're going to be starting an ABA master's training program to improve, to have more and better trained ABA providers for Brooklyn. Downstate also is involved in both basic science and clinical research around autism, and I'm involved, in fact, in running clinical trials on promising treatments. And if you're interested, we have a table about you can talk more about research opportunities. I'd also like to talk about Brooklyn's LEND program. This is the Leadership Education in Neurodisabilities, which is co-sponsored by the School of Health Professions and the Department of Pediatrics. And what it is, it's a training program that brings together many different disciplines: psychologists and ABA providers, occupational therapists, physical therapists, psychiatrists, social workers, but very importantly, as well as family members and self-advocates, individuals who themselves have autism. And the idea is that we all train together, that we learn from each other, teach each other, and our experience, we're now going into our third years. It's a wonderful program. And can I just mention, there's a LEND program, a LEND table going on outside, and you can speak to Dr. Jennifer Morrison-Diallo, who directs it. Part of LEND is the Family Support Project. It runs parents groups, it has an advocacy training program, and this is with the support of the Brooklyn Children's Society, and I would say it's part of Downstate's efforts to reach out to the larger Brooklyn community in terms of being in touch and working together. Finally, I'd like to talk about something that doesn't yet exist, but we're working on, and that's a lifespan clinic. It'll be based in the School of Health Professions, and the idea is to have one clinic that integrates care across all the specialties that matter. A kind of a one-stop shopping, that it would have developmental pediatrics and GI and ABA and social work and psychiatry, seeing patients together and coordinating their care. And very importantly, because this is often a problem, ensuring that as children grow, childhood, adolescence, and then transition to adulthood, that there's seamless continuity of care. So that's something we're working on. So I'd like to wrap up then, say thank you. If there's any questions or comments, I would welcome them. Thank you.